Welcome to our channel, where we bring you the most amazing stories from around the world. In this video, we bring you the tale of a fake doctor saved the lives of several thousand premature babies. Thousands of premature newborns were saved thanks to Dr. Martin Cooney, a doctor who made medical history. Despite the fact that there isn't much information available on this doctor, what is known about him is impressive. Dr. Cooney was born in 1869 in Prussia. When he moved to New York at the age of 18, he changed his first name from Michael Cohen to his current name. Cooney claimed to be a protege of a well-known French physician by the name of Pierre Constant Boudin, despite having no known medical training. Because he brought incubators to Europe, this French physician became well known. However, Cooney's allegation is not supported by any evidence. He spent 40 years of his life treating premature newborns, regardless of whether he had any medical training or a history in medicine. He had started his practice in New York and very soon expanded to other cities and countries too. According to the new book that has been written on him, named The Strange Case of Dar Cooney, How a Mysterious European Showman Saved Thousands of American Babies, by Dawn. Raffle Dar Cooney had been responsible for saving anywhere between 6,500 or 7,000 lives over his lifetime, in order to persuade the medical establishment that the proper care would lead to many more premature babies surviving. Dr. Cooney frequently stated that he was working to increase awareness of these infants. Nevertheless, he also wanted to make sure that the general public could recognize the advantages of this therapy and have faith in the ability to preserve their unborn children. Even when compared to contemporary norms, the tactics this doctor adopted were a little odd. The lives of numerous premature newborns were spared, though, and they were successful. He used to put preterm newborns on display in his incubators, and the public would pay a quarter to see them battle for their lives in those incubators. Despite the unorthodox nature of his treatments, this was a key source of money for his work, and Dr. Cooney was the only person providing this life-saving treatment. Incubators were not available in hospitals at the time for the treatment of preterm newborns. Furthermore, there was a general shortage of resources to assist the babies, such as nurses and mother's milk. Premature babies were considered a social burden in the United States, and they were referred to as weaklings in various medical journals. Professional doctors should have been working to save the infants, but instead they were eager to give up on them, thinking they were hopeless. However, Dr. Martin Cooney was not one of those physicians. Martin Cooney bestowed the title doctor upon himself in order to elevate both himself and his output. Because there was no internet, no long-distance calling, and no way to disprove his fictitious identity, he was confident he would get away with it. Additionally, it appears that after witnessing the success of his efforts to save premature babies, the public was pleased to accept him as a legitimate medical professional. Throughout his lifetime, he was able to save a significant number of premature baby bees. Don Raffle claimed that even after the kids were removed from the incubators safely, Dr. Cooney continued to live close by them. He used to receive invites to the birthday celebrations and even weddings of the infants he had saved. Martin Cooney paid barkers to stand at the entrance of the show and draw in visitors. They yelled things like, "Don't forget to see the babies." People showed up to see those babies because these slogans were effective in drawing attention. Cooney's exhibit used to receive a lot of frightened and terrified parents dropping off their premature newborns in the hopes that Cooney could save them. The parents of these babies would have little hope that they might be saved in hospitals, but Cooney was on a mission. An incubator would be used to house a freshly born infant after it had been cleaned, rubbed with alcohol, and tightly wrapped. Considering the patient's health, the temperature of the incubator was carefully selected. A small lift was used to transport all the nursing infants upstairs, where some wet nurses nursed them all. Any infants that were unable to suckle were fed using a spoon with a funnel on it. It is clear that Cooney was unable to save every baby he took in, despite the fact that he did not leave any records of his life-saving efforts. Even yet, he asserted that 85% of babies survived, and it is certain that his efforts saved the babies who would have otherwise perished. Most of the premature infant fatalities that he brought in are said to have occurred a few days after receiving them. In light of this, he said that a newborn would survive in the incubator for 7 days when he was a ripe 80 years old. Cooney passed away in 1957. Years prior to his passing in 1943, he had shut down his exhibit on incubators and preterm infants. His actions were a testament to his commitment to saving premature infants and giving them new lives. The fact that those newborns could have been spared was all also brought to light. However, the medical community did little to assist them. Thank you for watching this amazing tale of a time. A fake doctor saved the lives of several thousand premature babies. Don't forget to like and subscribe to our channel.